Our last speaker continues in this somewhat, sobering part of the discussion. But again, things we need to be so important and alerted to. Our last speaker today, certainly not the least of which, is Dr. Stephanie Marcello, is the chief psychologist, Rutgers University Behavioral Health Care, who will be giving us an overview of Gatekeeper training for suicide prevention. I hope I didn't mispronounce your name. I did a hard ch instead of a s. So if I got that wrong, I do apologize, doctor. But thank you so much. I'll turn it over to you now.
You actually said it perfectly. So hello, everyone. I actually put together a little PowerPoint that I'm going to share. I really enjoyed Chris's presentation, and I last minute kind of changed what we were going to talk about and didn't realize how well it actually went with exactly what Chris was talking about. So I'm going to share with you, and I do have slides here. There you go. And I can still see you and have the chat box out. So I'm going to share with you just an overview of what actually Chris mentioned Gatekeeper training for suicide prevention is. And so let's go. Here we go. So what's a gatekeeper? A gatekeeper is all of you. So yes, we are going to be talking about suicide, and we're going to be talking about signs and symptoms. But I bring it as a message of hope. And I know that it is such a, obviously challenging topic. And that's why sometimes people avoid talking about it. But I'm glad that we're all here today because we need to. That's the most important thing. But it's a message of hope. The more gatekeepers that we have, which is every human being alive on this planet, is all eyes on each other. The more community that we have, the more we're going to see healthier people who are living, meaningful, fulfilled lives for themselves. And when they're not, and when things are going wrong, they're going to feel okay because of that reduced stigma. Actually, Dr. Lisa's presentation too kind of all comes together, I think. So a gatekeeper, if you're not a licensed professional, no one is saying that anybody who is not a licensed behavioral health professional should be providing counseling or treatment. But all of those actions that everyone spoke about today, being that active listener, creating the space for it, if there's anything that you're noticing is just a little off, talking to the person about it in a kind, compassionate way. And one of the most important things, and I'll probably say this 2 more times, if you don't feel like you can talk to somebody about this, you connect with somebody who you know is able to do that. It's okay if you're like, I'm just not there yet. But then you ask a colleague or you ask another family member, hey, I've noticed this is going on with so-and-so. They seem a little different. Can you check in with them? And really what a gatekeeper does is brings hope. We bring hope through positive action. I see you. I want to know what's going on with you. I care about you. You are not alone. These are the messages that we send. So the S word, suicide, the elephant in the room, just like used to be, we talked about trauma being the elephant in the room that is standing right in front of us, but we don't like to talk about. Why is it so hard to talk about? I mean, there's so many reasons. And I also just want to take a moment to say, if anybody here has ever had a suicide attempt or struggled with depression or lost somebody to suicide, if this brings anything up for you, feel free to just lower the volume, go grab some water, or stay present. But we're here, and I just want you to know that this is what we're going to be talking about. It's hard to talk about because there's so many myths, and it's a hard thing to talk about, and hard things sometimes we want to avoid, and it requires a level of vulnerability. I have had friends, and I work a lot with people who've lost children and lost loved ones to suicide. And a common experience is what they'll say, people weren't allowed to come over, as if it was contagious, like they wouldn't let their kids come over, or friends, just stopped talking to them. Probably not because they didn't care and love them, but they just didn't know what to say. You don't need to know what to say. You just need to be there. There's really nothing to say but being there. So let's talk about what are some of the myths that stop people from addressing kind of suicide. No one can stop a suicide. It's inevitable. It's actually not true. All research supports to the exact opposite. If people get in a crisis, get help, they're less likely to be suicidal again. There is, he's just absolutely wonderful. A man who he actually tried to take his own life by jumping off the Golden Gate Bridge, and he survived. I'm one of the very few people that have survived that jump. And he talks about how he got on the bus that day. We talk about the brain going into like a suicidal mode. And he said, if one person smiles at me or says hi to me, I'm not going to take my life. And in fact, he had the opposite experience that day. People giving him dirty looks, wondering why he was taking so long. He didn't get a smile. and he did jump. Thank goodness he survived, and he's gone on to really bring a lot of positive messages and awareness. Another person I worked with, he talked about how he was also going to jump off a bridge, but there was too much traffic and he didn't want to get hit by a car. So if you think about someone's brain when they're in that state, I mean, he didn't want to get hit by a car, but he was going to go take his life. So absolutely, we can stop it. Confronting a person will only make them angry and increase the risk of suicide. Absolutely not. It's a common belief that if someone, a common myth that if someone brings up the word suicide, that you will put that idea in the person's head who wasn't previously think about it. There's absolutely no evidence for that either. It actually lowers the risk. It opens up communication. It helps people take a moment to not act in that impulsiveness. And it lets them know that someone's there and someone is caring about them. Only experts can prevent suicide. Absolutely not. There are so many people we never even get to see. That's why we need all of you. We need all eyes. We need to take care of and learn about suicide and depression, anxiety, and mental health in the same way that we would recognize the signs of someone, having a heart attack. We've all been really trained in the signs that it looks like when someone is having a heart attack and other health problems. How does suicide happen? Right. So someone loses someone to suicide around you in your life, and it's how, why, what did we miss? And we want to look for one simple answer because that's what human beings do. It must have been this. It must have been that their parents got divorced, or it must have been that they were getting bullied. And that's called what we call an oversimplification. And that individuals are so complex. And what leads somebody to this place is so many multitude of factors, which means there's lots of points of intervention too. And so we kind of might look at it like there's risk factors. So there's risk factors in terms of traumatic experiences in childhood, in terms of family history of depression, diagnosis of mental illness, right? There's environmental triggers, biological, and then there's stressful events that happen. And we're going to talk about what some of those stressful events could be, maybe going through a divorce, losing a child, those types of things. And then you start to notice that, and this, we're talking about human beings here, right? So I'm presenting it in a linear fashion, but nothing's linear when we're talking about humans and complexity. And then you may start to notice mood changes. So this is where a lot of people were talking about today. People in your life, coworkers, loved ones, children, youth, yourself, start acting differently. It's like they're just not themselves. And it's not just like a day. We all have a bad day, but this is kind of going on and they're doing things that they haven't typically done. We want to check in with that person. We want to get them connected. This is where we really want to have some kind of intervention. So if you go through a Gatekeeper training, this is where we want to make sure that we're addressing. And I'm going to go into exactly how to do that in one of the next slides. And then there's access to means. So one of the things we always talk about is, does a person have a gun in their home? If someone has these risk factors, the stressful event, these mood changes, and they have an access to the way that they are going to die by suicide, their plan, if they have pills in their home, firearms is a huge one, that increases the chance that someone will take their own life. And that's a high risk. So means reduction is really, if you're having a loved one in your life and you're noticing that they seem more depressed, more down, you're getting them connected, anything in your home, if they live with you, or asking somebody, do you have a gun in your home? Is it locked up? Anything do they have pills? Those pills need to be removed. Anything that gets out of their way, because remember, you're not dealing with a brain that is really functioning in a healthy firing in all type of cylinders. You're dealing with this brain that goes into a suicidal mode. And that's actually what inpatient does. Inpatient really, when someone is in a psychiatric crisis for a suicidal attempt or suicide thoughts or feelings, it's not really a ton of treatment. We're really trying to stabilize that individual to keep them safe, and then can start treatment, start medications if needed, start group therapy, but then really connect them to really address what just really happened to them. 90% of attempters who survive do not go on to die by suicide later. So it's not like, oh, there's no hope for that person. They want to do it, they're going to do it. Absolutely not. That's another myth, complete opposite. We also know that firearms used in youth suicide usually belong to a parent. And I know we're talking a lot about adults today, but to also throw in, I know Chris talked a lot about youth, is youth tend to tell each other. So, your teenager or a loved one's teenager is going to tell their best friend, typically not their parents. You may notice mood changes, which is hard to differentiate because I have 2 teenagers and my one son asked me if his sister's an alien, like daily, because they just act kind of differently, right? But they tell friends. That's why we need friends to also be gatekeepers. I had to throw this in here, and this is so important. Remember this: connection is protection. Connection is protection. We are in, and the Surgeon General just declared, the loneliness epidemic. Lacking connection is connected to so many health-related behaviors: heart disease, increased Alzheimer's, stroke, increased levels of stroke. And they compared it to premature death, smoking 15 cigarettes a day. So there's been a lot of discussion around this as a culture problem. And when I say loneliness, I mean connection, because you can be in a room, I think we've probably all heard this a lot, with 10 people and still feel lonely. It's connection that drives that. And when, youth and adults are feeling like they're getting that connection online, there's something missing. There's something really missing from that. Do you really know the individuals you're messaging or chatting with? Being in person with somebody, looking at their eyes, looking at their face, connecting to their nonverbals, that's powerful. That's connection. So connection is protection. If you're struggling, or anybody in your life, get connected. Find your people. Find the people that make you feel safe, make you feel heard. Find the people you can be silly with and be honest with about the real deal. I like to say to my friends, all right, what's the real deal? What's really going on? I don't want I'm busy, working a lot, kids are good, we're going to baseball. I can do those conversations, but when I'm with my friends, tell me what's really going on. I really want to know, because we all have this stuff going on. So just to go over some warning signs, the more clues and signs you observe, the greater the risk. We want to take it all seriously. These are some from a gatekeeper training. I'm a certified question, persuade, refer trainer. So this does not mean you're certified in attending this. This is just let you know that this does exist out there. So people have a lot of verbal cues. I've decided to kill myself. I wish I were dead. We don't say the word commit suicide, but sometimes people still do. It's not a crime. We say die by suicide. Language really does matter. I'm going to end it all. Or you'll hear people say, if something happens, if I lose my job, if my wife leaves me, if my husband leaves me, I'm going to kill myself. Take them seriously and watch your response to not just be like, no, you're not. You're all right. You don't really mean that, right? So we want to respond in a way that doesn't kind of give the person an out because we're anxious, or indirect cues. My family would be better off. I just want out. Pretty soon you won't have to worry about me. Behavioral cues. So look at these mood changes: depression, hopelessness, giving away prized possessions, unexplained anger, aggression, and also people who might be using, who have been in recovery and start using again. And then remember those kind of life events in that diagram that I showed you. So a huge change: being bullied at school, that's been going on really long, loss of a major relationship, a death of a loved one, anything that's really significant life change that puts somebody who has all those other pieces at a more vulnerable risk. Someone who's struggling with financial challenges. If you hear people talking a lot about, it's a common belief in people who are in that place where they're thinking about taking their lives, that they're a burden, that they really do believe that they are a burden to others. And remember, suicide is about not wanting to suffer. It's about suffering. It's when someone's suffering is so bad that they cognitively convince themselves that people are better off without them, that they're all going to, not that they're just not going to be okay. They're actually better off. And they believe that. They believe that as if you try to convince me I'm not wearing a gray sweater. So we want to intervene and disrupt that type of thinking. So here's what we could do. You can actually ask somebody, are you thinking of killing yourself? You can say those words. Are you thinking of taking your life? Use the word suicide, kill yourself. You can say I've had times in my life where I felt really down and I've thought, maybe I should kill myself, right? If that is something you've experienced, is how it's happening with you. So it's the way we say it. Or you can ask them have you been unhappy lately? Do you ever wish you could go to sleep and not wake up? And again, if you can't ask them, find somebody who can. So we don't want to say, you're just kidding about killing yourself, right? or you're not really thinking about killing yourself. Because that's basically telling the person, like, I really can't handle it. Please don't tell me. And then what we want to do is give them our whole attention. We want to persuade somebody to stay alive. Hey, we want to say, you matter. I'm so glad you're here. I'm so glad you told me. We got this. I'm not leaving you. We're going to figure this out. We're going to get you connected. And listen. And we're going to offer hope. Well, a lot of people have felt this way and they're okay. You're going to be okay. We are going to do this together. And then we want to not leave that person, and we want to connect them with help, refer. And then I have this, like, we have the 988 suicide and crisis line. You can take them to any psychiatric screening. You can take them to the emergency room. What about those that experience complex PTSD? Are they any bit more likely to attempt suicide? Yes. I think that with any increase in those vulnerabilities, we need to be aware of. So it's like when someone comes in to see us and we're doing an intake, if I know that someone has been dealing with PTSD and traumatic situations, and complex trauma, which is trauma that kind of just goes on for years and years. It could be living in poverty. It could be, living in an urban area with a high crime rate. It could be those kinds of things. So let me just finish up right now. But yeah, those are all vulnerabilities and extra risk factors for individuals. So I'll stop. I know that was a lot of information, but I think the more we talk about this, the more we normalize that this is just part of the human experience. A lot of people have gone through this. People can survive and be okay. And just remember, connection is protection.
Oh, great presentation, Stephanie. We need to think of ourselves, right, as those gatekeepers. And we can make a difference. When you were telling that story about the gentleman on the bridge and people walking by just looking at you like, what are you, crazy, right? And somebody not taking and not feeling that they can intervene or just not caring. I mean, I think as a society, we've just become so jaded and cold to things. We have to get sensitized again. We're desensitized as a society. And, it starts with each and every one of us sensitizing ourselves and putting ourselves present in the moment to understand what's going on around us, right? And then being part of any solution that we can. So thank you so much for sharing that overview with us. Hopefully none of us have to deal with it, but you know what? If we see something, say something, and be that gatekeeper. So yeah. What a powerful, powerful program today. Thank you, Dr. Marcello. What a powerful program today. I want to thank all of the speakers who joined us today for what they do. Clearly, the work that they do each and every day impacts our communities, impacts our society, impacts our families, impacts our workforce, right? This is not easy work. My daughter's a mental health therapist, and I see the pain on her face some days by what she's dealing with recently. So for all of us, I think we got some great tips on our own self-help today, right? How can we clear the noise around us? It's incredible. I came into 2023 saying noise-free in 23 and thought, new year, I'm gonna cut all this noise. It's really hard to cut the noise, folks, right? Do our best each and every day to intentionally decide what we want to have in our line sight and what we want to block out to help us stay focused. It is not easy. It is not easy at all. But thank you to all our speakers for your incredible presentations and for sharing your expertise with us today. Thank you to all of you for joining us, for taking the time on these important issues, be it for yourself, for a colleague, for a family member, or for a community. We need you. And of course, I want to thank the incredible support of our partners. A shout out to all of those on the screen, 2 pages full. Without them, we can't do events like this. And finally, I want to thank the team at NJBIA who works tirelessly to put these programs together and to make sure that these programs are timely and relevant for the issues that are impacting us each and every day. So I wish everyone a wonderful day. The sun is shining. It is a beautiful day in New Jersey. Carpe diem, please seize it. All right, today and always. And NJBIA is here to continue to bring you resources any way we can. Thank you so much. Have a great day and be well, everyone.